Ramadan and the Eid al-Fitr we will observe next week be Mubarak. Since the beginning of the coronavirus pandemic, you have served tremendously, and for all the services you have offered, I would like to extend my gratitude personally and on behalf of my nation and my family. As known, the past 2 years of the whole world took place under the shadow of this pandemic. This process, which started as a threat in health, in very short time that spread across many fields such as education, industry, production, manufacturing, and it has become a full-blown pandemic. The natural flow of our lives had to be reorganized in the face of the situation we were faced with, and every country, in line with their own capacities and capabilities, started fighting the pandemic. From hospitals to healthcare professionals, from masks to drugs, from ventilators to vaccines. Under every title of items, tremendous challenges were faced. At the airports or border gates of great countries, many fights took place, if you will, to grab some masks, as we all witnessed. Most importantly, the administrative capabilities of states were tested. And Turkey has been one of the few countries which performed very well in the face of these tests, not being crushed under the heavy load exposed. Our health care infrastructure uh, did remain resilient in the coordination of our health minister and with the services of our healthcare professionals. And I would like to congratulate this scientific board for the great services they have made for our country. By the way, another important thing, we unfortunately lost many professors, the names of whom I will be mentioning very shortly. The late Cemil Taşçıoğlu, Professor Taşçıoğlu, the late Professor Murat Dilmener, the late Professor Feriha Öz, like figures who lost their lives in the pandemic. We have named hospitals after them, and we consider these hospitals as the symbols and those figures as the symbols of the fight we had against the pandemic. And of course, having their names live on was a very crucial step for us. In many other countries, people's access to healthcare institutions were limited. However, we have not only constructed city hospitals and state hospitals, but with emergency case hospitals and all other hospitals, we have put to service more than 16,000 new beds as of capacity. Along with meeting the needs of social issues, we have not allowed any sort of weakness in all services delivered. Uh, some practices, such as community service groups, always stood with our people, such as VEFA groups. And with the resilience and patience our nation has shown, we know that they have also contributed much to this whole process. Just like in all areas, our guide, our compass, and the biggest source of power in the face of the pandemic was the light of the science and also the efforts of our scientists. The threat of the pandemic started to be announced in the whole world, and right after that, our scientific board and sub-working groups were established under the coordination of our Ministry of Health, and they have closely followed all developments, and the World Health Organization also recognized that. Both at the international bilateral meetings and in all other meetings, they articulated that very clearly. The COVID-19 pandemic management system and also working guidelines updated frequently and all the time emerged as our documents of guidance and direction. Following all the procedures and measures and also following all therewith, of course, was not easy. As a government, in line with scientific information, we have tried our best to correlate all with the expectations of our nation. But thanks be to God, we have brought our country a very healthy and safe and sound grounds to very healthy and safe and sound grounds, and we feel the ease and serenity of that. Distinguished friends, in the beginning of the pandemic, there were many issues related with the virus, the reasons, the root causes, or the consequences of which were not fully known, and there were many ambiguities. The source of the virus, as some declared, came from China, and it turned out to be frightening everyone. As the pandemic that further spread, the observations of the science world indeed brought and exposed us to new information, pieces of information coming our way every day. And we have exerted efforts to bring all methods, instruments to our country to bring this fight to the foreground. The more we analyzed our own data, the more knowledge we have had, and we have come up with our own methods of a fight against the pandemic, with the initiatives of our scientists from locally developed ventilators to diagnosis kits and all the way to locally developed vaccines. We have undertaken many initiatives. We are one of the 9 countries in the world which is able to produce its own vaccine. All the products we put to service to fight against the pandemic and all the know-how, experience we have had so far have been shared with the peoples of the neighborly and sisterly countries in our geography, and we delivered on our duty of humanitarian assistance. Across the world, we have provided assistance, medical assistance, to more than 160 countries and 12 international organizations, and shown our difference in terms of humanitarian awareness. To speak frankly, starting with the developed countries, the whole world has not adopted an approach that can be fully appreciated. Other than their own interests and welfare, many countries have not cared for many things, and this selfishness has now go down to the pages of shame of history. As Turkey, the lesson we have drawn from this has been to do with the fact that we had the need to be self-sufficient in terms of healthcare services, infrastructure, and supply. And hopefully, with our strong infrastructure and human capital, we will have achieved our goals to the full. And of course, throughout this process, the efforts of our scientific board and all members of our scientists have been appreciated, and we witnessed their efforts clearly. I would like to state in particular, over the past 2 years, without expecting any financial return, Valuable scientists spared their whole time to fight against the pandemic, and I would like to extend my gratitude to each and every one of them, starting with our minister and his team. Our army of 1.3 million professionals served 24/7, and we will never forget their services. And the Ministry of Interior Affairs, Ministry of Education, Ministry of Family and Social Services, and Religious Authority Administration, and all other institutions and their members. I would like to congratulate them as well. And a part of our thanks to the healthcare professional also goes to those with whom we have come up with many regulations. And now that the pandemic has no longer been a full threat, the European countries, almost all of them, as you know, lifted the restrictions, and we believe that our country has come to this stage now as well. So much so that during the coronavirus scientific board meeting, we have in great detail elaborated on all relevant issues. As long as there is no extraordinary situation, the scientific board has come to the idea that there will no longer be a need for regular meetings, and our health board, of course, will continue with their studies within the framework of the coronavirus pandemic for about 3 years. The the there was the mandatory need of wearing masks in indoor areas, and it will no longer be mandatory to wear masks in indoor areas. Only in public transportation it will be necessary, and this will continue until the number of the cases reported daily goes below 1,000. Those with senior age and also those who have contact at risky people and those with chronic diseases are suggested to wear masks. Starting with the scientific board suggestions, I would like to state that the vaccine has been our biggest tool to fight the pandemic, and everyone is suggested to receive their booster doses. Our locally developed vaccine, Turcovac, is in particular recommended as a booster dose. For that, at public hospitals and healthcare centers, vaccination centers will continue with their services to meet the needs. The coronavirus drugs produced in our country will be distributed to our citizens free of charge. Updated treatment methods and everything relevant will be closely followed. May God bless us all, our citizens, and the whole world with days of welfare, health. I, with these thoughts in mind, would like to thank to the members of our scientific board and wish them the best of success in their studies. I would like to greet each and every one of you with love and respect. Thank you very much. Stay in health.